If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 15th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, you can call the live phone line at 718-499-6101, and second, you can email your questions to askthedoctor@netny.net, and we'll bring them into our discussion. And only for this season is the Net Viewers Survey. Now, if you haven't done so, please take the time to participate as you wait for your turn to go on the air. The survey's here because we want to give you the chance to officially and anonymously sound off your opinions about Ask the Doctor and net programming in general. Now, for those who could not get through or are not on our mailing list, please write to the Net, N-E-T, at 1712 10th Avenue, Brooklyn, New York, 11215, and ask for the survey to be mailed to you. Of course, you can participate online at netny.net. It's very important that you fill this out because the management looks at this sort of as a Nielsen rating and is looking to see how well shows are doing to continue for the next season. Now, for this episode, we have a stellar group of people. Wait till you hear this. Number one, Dr. Margarita Kutsina, internal medicine and geriatric attending at the New York Methodist Hospital. A great guest from last year, you remember Dr. David Shifter, cardiology attending at New York Methodist Hospital. And Dr. Robert Seminara, who's been here countless times, breast disease specialist at New York Methodist Hospital and director of surgery at the Brook Plaza Ambulatory Surgical Center. Welcome to all of you. It's great to be here. We have to get a little business taken care of. So we'll start with In the News, then we'll go to our quiz, and then we're going to get to our doctors. So in the news today, there was one of these bizarre type stories. Apparently a federal panel has recommended that children should be tested with anthrax vaccine to determine the efficacy of the vaccine. Now, there are a few things that I find wrong with this. Number one, where is the clear and present danger that there's anthrax coming? And now you start giving kids the vaccine. Soldiers were given the vaccine, 2.6 million, and there was a very severe reaction in every 1 out of 200,000 tested. So it seems to me where we can't even get our children to be vaccinated fully for measles, mumps, and rubella because parents don't want to allow them. This seems like a much tougher sell, and I would agree with them in this case, that it's something that could be treated with antibiotics should there be an anthrax attack. So I think the key would be to get systems set to deliver the antibiotics where necessary after an attack, if it ever should happen. So I hope that this is not going to go very far, and I definitely will not my children get vaccinated with that. Low back pain and yoga. It seems that yoga helps low back pain. It works as well as stretching exercises and other types of physical therapy, and have added bonuses. And we'll ask Dr. Shifter about this. Apparently, it works to decrease irregular heartbeat in heart patients as well. So there are many effects, and also relaxes people in general. So maybe yoga is like a great drug, not only for back pain, but you get the benefit for heart and just mental health as well. Every week we talk about coffee, it seems like, and this week's coffee highlight was that it may prevent skin cancer. And they did studies, and women who drank at least 2 cups of coffee a day had a 20% decrease in basal cell cancer of the skin, which is the most common type of skin cancer people get. Again, nobody knows why, but it just is associated with that. So we've seen so many over the last few weeks, whether it's pancreatic cancer or gallbladder disease or heart disease, that coffee with caffeine does have some kind of a benefit. And that's regular American coffee, Cafe Americano, not the espresso or the French roast. So it's interesting, and we'll keep following that. I see Monsignor Bennett sitting there. No show would be complete. Well, he only missed 1 show in 15 seasons, which is fabulous. Monsignor, thanks so much for coming. And I know he likes coffee too. Yeah. And the quiz is a tough one this week, so I think I want to get your pencils and papers out and think of the answer to this one. What's the '1 reason people call in sick to work? The '1 reason. I know I'm thinking a lot of things. We're going to get a little insight into what you guys have called in sick over the year. Although this group doesn't call in sick unless they're really sick. But let's see what the '1 answer is. Now, A phone number to call, and I see the busy lines are lit. The number to call is 718-499-6101. And let me remind you the topics. Tonight's topics are geriatric and internal medicine, cardiology, breast disease, and surgery. Also, email your questions. We want to see the emails to askthedoctor@netny.net. And please, please take that survey. Very important to keep us on the air. So don't go far. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are geriatric medicine, internal medicine, cardiology, breast disease, and surgery. Now, I want those who are waiting online to know that there may be a little delay today because people are filling out the surveys, but stay on the line. Don't go anywhere. So let's meet our doctors. Dr. Marguerite Kutsina, who's no stranger to the show. How are things going?
Yeah, things are going very well. I'm really glad to be back on the show, and thanks for inviting me.
I always like to start and end with a tidbit, like a little health tip. Give a health tip for our patients out there, either geriatric or internal medicine.
I would strongly advise anyone, please follow up with your doctors regularly, and I think which is very extremely important is the screening. So for women, please get your annual mammogram. For men and women, please get the colonoscopy as scheduled, as recommended by your doctor. And again, the advice for women is please get the annual pap smear and see the gynecologist.
Good advice, good advice. Dr. David Schifter, and we're so happy to have you last year. Great to have you back. How is the family?
Everybody's fine, Steve. Thanks so much. I want to congratulate you on your 15th season.
Wow, thank you.
And I think you're providing a wonderful service to the community, and we're happy to be here.
Thanks a lot. I wanted to point out, I know they're modest about it, the two gentlemen on the panel were past presidents of the New York Methodist Hospital medical staff, which is, I think, a thankless job. I mean, you go out there and you make sure things are done fairly. They're being done according to the way that they should be done, and I want to thank both of them for their service. Tremendous. So anything new with any trips, any new trips, or anything exciting happened since we saw?
On the same line of questioning for Margarita, one tip you could say is I get a question quite frequently, or calls in the office. I missed the medication. Should I double up on my medication now? The answer is no. Take the next prescribed pill at the regular time. If there's any questions, speak to the doctor.
That's a good one, because sometimes you forget and then it happens to everyone. I'm thinking, I'm glad to hear that. Good tip. So we'll be getting to a lot of cardiology questions for Dr. Schifter, and save them up here. Now, Doctor, how are you doing, Robert?
I'm doing great. I'm very happy to be with you tonight. And also, like Dr. Schifter, I want to congratulate you on your 15th season. I think also, all I do is hear more and more wonderful things that the community speaks to me about your show, and the service you perform and what you bring to the public is a wonderful thing, and I know you're helping a lot of people.
Thanks a lot.
I think you're doing a great job. Thanks. We all do.
What do you think of these health guidelines that say that women shouldn't be getting mammograms between 40 and 50?
Well, you know, Steve, I can talk about breast probably this whole hour because I've got a little mission here, and I think that that's a very dangerous statement if I have to answer the question just like that. But the real answer about breast is this. This is Breast Cancer Awareness Month. And it's a little disappointing to me that with all the money that's being gathered, and we're walking, everybody's walking, I'm happy, you're walking, and we're all walking. But I want to see more money spent on education. And along those lines, I'm a little tired of another new chemotherapy drug that might enable a patient to live another 3-4 months. I want to get there early. And the way we do that is with education. And there's not enough time or money spent on education. So the answer for me is this. If I'm to give a little tidbit, is for women to be proactive and realize there is no one thing regarding breast cancer that's going to save lives. It's a conglomerate. It's mammogram. It may be no mammogram. It may be sonogram. It may be MRI. and clearly it may be being examined and seen and educated by the surgeon.
Great. No one size fits all.
So it's not one size fits all, and then you know what? Nobody dies of breast cancer.
I know you've been on the show. That's been a frequent comment that you've made.
Right.
So this is like the lineup is made. I feel like it's Yankee Stadium. We know the lineup. We had an all-star lineup. Now we're going to get to the calls, and we're going to see who's our first caller of the night. Could it be Maddie, Joel, Grace? I don't know. Hello? Who is this, please?
Hello?
Yeah, hi. Who is this, please?
Grace.
Grace, how are you?
Yeah.
You're our first caller of the night. Could you talk a little closer to the phone?
I'm coming along a little bit better with my knees. I'm taking Advil because I have the osteoarthritis.
Yes, I remember.
That seems to help. I take about 3 a week.
3 a week is good. There's not that many.
No. Sometimes I have to take a Sulindac, but I'd rather take just an Advil.
We missed you last week, Grace.
Yeah, I know. Well, I've been having trouble with my mouth. I have dentures, and I was getting like electric shocks under my nose.
Oh.
The pains were like electric shocks under my nose, and I went to the dentist, and he checked me out, and he said, I thought I had TMJ, because even when I washed my face, I used to get these shocks.
I can hear you're not happy. You're not happy tonight.
Yeah, I know. I'm a little excited.
What can we do for you tonight, Grace?
Excuse me?
Do you have a question tonight, or you have
Yeah, well, I wanted to ask you about the dentist said I need a neurologist. So I called my medical doctor. He says, see how you get along. It might simmer down. Because he said the dentist said it's not a TMJ.
All right, let's ask Dr. Katsina about this. Grace is out there, 77 years young, right?
Right.
And she's having this aggravation with the TMJ. What do you think about that?
So, it is very difficult to just, give you advice just over the phone. But first of all, you have to make sure that it is a TMJ, because you may have something, if you talk about the shocks that you feel, that it may be just the trigeminal neuralgia, and there are effective medications to treat the disease. And it can be very debilitating because the pain is tremendous. So what I would recommend you do is please speak to your doctor and ask for the referral to the neurologist if your doctor is not certain or uncomfortable prescribing certain medications. If you do not have any neurologists, you can call in and we'll give you the names of the neurologists that are affiliated with Methodist Hospital.
So, Grace?
Yeah.
I hope that helped you. It's a real problem.
Thank you for your opinion, but I wanted to let you know that I was using salt water. I removed my teeth during the day, and now I practically feel normal.
Very good. So
you went away. So.
Excellent.
Okay, very good, very good. I'm glad. Yeah, we're glad to hear that.
Yeah.
Grace, you have an answer to the quiz?
Well, I'm thinking about what's the quiz again, please?
The number one reason that people call in sick to work.
The only thing I can think of is to have a good long weekend.
Okay, it's a little cynical, Grace. All right. Could it be to have a good long weekend? And Grace, you've won a couple of these, haven't you? Grace?
Oh, and I never got my T-shirt from 3 weeks ago.
I'm telling you, the person who ran the T-shirt department is gone. We got rid of him. So we got a new guy working on it, all right?
Okay.
Look for it this week.
Okay, thank you.
Have a nice week, Grace. Let's go to Marie. Hi, Marie.
Yeah, hi. Is this Dr. Garner?
Yeah, hi. Where are you calling from?
Brooklyn, New York.
Can you be more specific?
Bensonhurst.
We love you. Yeah, you called out we heard from you a couple of weeks ago?
Yeah, no, I didn't call. I called maybe a couple of years ago.
Oh, it seems like time is just like yesterday. I don't know.
Oh, a year ago. Yeah, the reason why I'm calling Dr. Garner, I have quite a few number of things wrong with me, all right?
Okay.
I was diagnosed with Epstein-Barr, chronic fatigue, fibromyalgia. I have chronic sinusitis and I easily catch colds, sneezing, and all that. And the doctor told me that I should see an ear, nose, and throat. I went to the ear, nose, and throat doctor, and he said that I have a deviated septum.
Okay.
But I know a lot of people that have deviated septums, and they still have, they're able to cope and deal with it. So and also a herniated disc in my neck, and I don't know, if it's from the fibromyalgia or from the herniated disc.
How old are you, Grace? How old are you, Marie?
69.
69. So you've got a number of problems here. I'm going to ask Dr. Shifter. You see patients that come in with the Epstein-Barr virus or fibromyalgia?
Not too frequently, though it's a very common disease. And the cause of it, fibromyalgia, is little bit controversial. I think that a good history and physical exam from a good general internist is the first thing she should do. Complete blood work, and then take it from there. Maybe a neurologist or a rheumatologist after that.
Have you had that done, Marie?
Yes, I've had all that done.
I think you need to see, I agree, you know, rheumatologist would be a good choice because a lot of these problems go together. You know, you mentioned this and this and this, different parts of the body. They could all be related. It's nice if you could relate them to one disease process.
Well, they gave me Flexeril, you know, a muscle relaxer, and it really doesn't do anything.
Yeah, I mean, have you used antidepressant medication on these?
Yeah,
patients?
Well,
so
I've tried Celexa, but I don't know. I was on it for about a week, and I weaned myself off. The doctor said to wean off.
I see. I think it's you could see there is some number of different other antidepressants that are effective in somebody who has fibromyalgia. And I think it's a good idea to try them. And if you're still suffering, so you definitely, whatever is being done is not working for you. And plus, before you decide if the medication is effective, antidepressant, for instance, that you have to just give it a little bit of more of a time, because certain medications, for instance, they use Cymbalta. It's something that is effective in fibromyalgia, may be effective in fibromyalgia, that it usually takes about 4 weeks to reach its full effect. So please again speak to your doctor, and but it is a challenging diagnosis.
The only problem, I have to say, doctor, with antidepressants is they tell you the side effects. Some want to commit suicide, some gain a lot of weight.
Right.
I mean, also I'm on Ambien. I have to take Ambien every night. And I don't know if the Ambien is making me tired during the day or if it's a chronic fatigue. It's hard to, you know, distinguish. I can't distinguish which one is causing what.
Let me just ask Dr. Seminary. You had a comment.
Yeah, you know, I'm really thinking about yoga. In your opening monologue, you talked about this.
No.
And yoga is a mind control thing that helps you cope and deal with so many of these problems, and may be able to put this together rather than have a little bit of fractured care.
Well, can I tell you
your neck
something, doctor?
hurts.
I don't believe in yoga. I go to the Catholic prayer meetings, and we praise the Lord, and we raise our hands, and it's more of a healing than
Great.
anything I can tell you.
Yeah, this
Well,
is
that's
When I
great.
come out
I
of there,
agree with
it's
that,
like
too.
I'm coming out of a hospital healed.
Marie, it sounds like, you know, it's a rough road. It's not an easy, not an easy treatment.
Right.
And did you ever see the Golden Girls episode where?
Yes.
Yeah, that I don't know if you saw that,
Right.
but I forget her name. What was it? The gray-haired woman, and you feel frustrated that nobody believes you're really sick.
Yeah, that's right. They
So-
think I'm a hypochondriac.
I think, you know, maybe you want to check in with one of the rheumatologists in the area.
Okay.
All right, give us a call back. Let us know how you're doing.
All right. God bless you, Dr. Garner.
Be
And
well.
Dr. Garner, go to Il Finetto in Shipstead Bay. It's a good Italian restaurant.
Isn't that the one where you could see the
Yes.
water?
Yes.
I think that's the only one you could
nice.
see the water. I got to get in there. Anybody to ask for?
I forget. John. His name is John. Also, there's another one, Sorrentino's in Brooklyn.
Sorrentino's I used to love. What avenue is that?
That's on 11th Avenue
Yes.
near 65th Street, I believe.
In the middle of the block.
Yes.
I love that place. Excellent.
Okay, Dr. Garner. Take care. God
Thanks
bless
a lot.
you.
Be well.
Bye-bye.
Before we get to Pat, I have an email. That's email number 1 of the night is from Warner Robbins in Georgia. So we're spreading out across the country. Georgia, it's nice. Big time here. Do you think that the anthrax vaccine is safe for people who have arthritis? I had arthritis and received the anthrax vaccine. After the anthrax vaccine, my left wrist degenerated and I was diagnosed with rheumatoid arthritis. I'm convinced the anthrax vaccine caused or worsened my rheumatoid arthritis. It is noted in the NIH literature that the anthrax vaccine can cause or worsen rheumatoid arthritis. Military personnel have been rated 100% disabled in cases exactly like mine. And again, every vaccine, everything has risks and benefits. And the thing I was trying to argue before was that I didn't think the benefits outweighed the risks of the vaccine, which can be autoimmune process such as rheumatoid arthritis, and you can also get nervous system problems. So I would, I think in the military there was no choice. I think everybody had to be vaccinated. But if you're not in the military and you have a choice, you may want to consult with your rheumatologist beforehand. In my opinion, I would avoid this until I saw more of a threat, which I don't see right now, a threat for anthrax. Could happen in the future, but we can treat it with antibiotics should we become exposed. So, yes, Dave. Sure.
Yes, being from Georgia, he's very close to the Center for Disease Control, just outside of Atlanta, so maybe a good resource for him to check in there.
So I hope that helps you. Good point. Yeah, right there. And again, nothing is open and shut case. You want to be open-minded about it, but get as much information as you can. I think we have Pat waiting patiently on line 4. Hi, Pat.
How you doing, Dr. Garner?
Pat, how you doing tonight?
I'm okay, Dr. Garner.
Pat, you never told us where you like to eat.
Oh, you know where I like to eat, Dr. Garner? Don Pepe's in Queens.
I never heard Don Pepe's in Queens.
Ozone Park,
Yes, I've heard of it.
beautiful spot.
It's very good.
Really,
Dr. Schiff is acknowledging that he's been there. He likes that place.
yeah,
Don Pepe.
really nice place.
Where's that? Is that near
It's right
Woodhaven?
near the Aqueduct Racetrack.
Oh, okay. So you can get a little bets in and have a little
Yeah.
food.
Yeah, that's true, Doc.
What's the guy's name in there we should look for?
Mikey Don Pep.
Mikey Don Pep.
Mikey Don Pep.
Yeah,
So he calls himself Mikey Don Pep, but he calls it Don Pepe's.
right.
Very
right.
nice. Good,
Yeah,
good.
yeah.
What
Very,
can we
very
do
good
for you,
place.
Pat?
Doc, I went to the doctor. I'm suffering with this dizziness.
Pat,
And
just to fill you in, Pat has vertigo. He's dizzy. He gets panic attacks as a result of them.
Right, and what happened is the doctor looked down my throat, and my tonsils are so big. There's about a half an inch in between the two tonsils. They're so big. So he's suggesting that I have them taken out, and it's also giving me I got a pain in the back of the neck. I don't know what it is, Doc.
Well, we got the surgeon here. Let's ask him what he thinks about those kissing tonsils.
Well,
Almost kissing.
a lot of people talk about sleep apnea.
Right.
And sleep apnea today is a big deal, and a lot of investigations are going on. Sleep apnea centers and clinics and departments are developing in many, many hospitals. It's very possible, very, very possible that if you have this kind of a problem, this could also interfere with your sleep, not get a good night's sleep, not get the kind of REM sleep you need to bolster you for the next day. So those tonsils sound like they've been there long enough from the way it sounds.
Doc, the only thing is I do use the machine to sleep, the sleep
The
apnea.
CPAP.
Well, there you go.
And now the problem is also I have a deviated septum. I can't even breathe through my nose.
Well, you know what? Already you have a problem, and we didn't know that, but apparently it's existing. I think that I would consult the sleep specialist and your ENT doctors, and you know what? You just might get a whole lot better.
I just
I
want to
think
ask
you ought to
Dr.
look
Schiff
into it.
one question about sleep apnea and heart disease. What do you think?
Right, excellent thought, because I was just going to chime in, but there's been a very strong correlation between obstructive sleep apnea and episodes of where the oxygen drops in the blood during your sleeping. This could affect the heart function. Not only the function, but also you could develop arrhythmias. This is a very common thing and should be looked into.
Anything else that
No, I think
great.
you've completed it all.
I'm 50. Is it dangerous to have that operation on my tonsils?
Absolutely not today. Every surgery needs to be taken very, very seriously, whether it's a tonsillectomy or an ingrown toenail. You don't just do something like that.
So, Pat, we're going to move on. What about you got an answer to the quiz?
I think it's a hangover, Doc.
A hangover. Interesting. I would have guessed you, Pat. I knew you were going to say that one.
It
What
was
do you
from
think?
Don Pepe's.
Is that a good place? Nice little bar. There.
Shaky, yeah.
So Pat says it's a hangover. Pat.
All right, Doc.
It was in the top. It was in one of the top answers, but not that one.
Doc, I just want to say hello to my friend Johnny. He had a little prostate problem this week, and he's out in the hospital recovering.
All right, pick up the phone and call him.
Thanks
All right,
a lot.
thanks a lot, Pat. Take care. Okay, we're going to go to Mariana now. Hi, Mariana.
No, this is Rosemary.
Oh, one of my favorite callers, Rosemary. How are you doing?
Oh, good. How are you, Doctor?
I didn't see you in Manchester this year.
I know. I didn't go.
Oh, I was looking around for it.
But I've never seen you. I told you when I see you, I'm going to just drop dead on the floor.
Oh, no. I know CPR. She wants me out to.
Well, you know CPR, so then I'll be okay.
You're okay.
Anyway, should I give you the answer?
Oh, you have the answer. Okay,
well,
let me
let
me build it up.
A fever.
Let me build it up a little bit.
Build it up.
Okay, the number one answer to the question,
Right.
why is the number one reason people call in sick? And Rosemary says,
they get a fever.
a fever. Is it a fever?
No. Come on.
Oh, Rosemary, so close, so
Well, I
close.
have two already, so, you know.
You have two of those, yeah.
Yeah, so that's...
What do you think about panel tonight?
Oh, I think they're wonderful.
It's a great panel, yeah.
Oh, what a wonderful panel. I also want to say I'm saying a special prayer for Pat. Every time he always calls, me and him call the same time. And he has so many problems, and he seems like such a nice guy.
He's a nice guy.
Oh, I'm praying for you, Pat. So anyway, my question to get to it is, a test for Alzheimer's or some tests for dementia. Is there any real test, like, you know, that they can tell you that you have this condition, and any kind of preventative medicine, you know, anything that you could do to prevent it?
All right, let's see Dr. Kutsina.
I
You
know
must
you
get
have
patients.
geriatric.
Yes, of course. So, I mean, unfortunately, there is no definite testing
Right.
for Alzheimer's. But there is some different, you know, questionnaires. People, we do neuropsychological testing, different blood work. So we can, with the certain probability, determine that somebody does have dementia, Alzheimer's,
Right.
or does not. But there is no definite test.
Okay.
When it comes to the prevention of dementia, I think the best way, again, it's the best way to diminish the chances of developing dementia would be, you know, diet, exercise, and please keep your mind occupied.
Right.
Doing puzzles, communicating, get, you know, people go to churches,
Right.
some support groups, volunteering, anything you can do to keep your mind to keep your mind active. And again, of course, regularly see the physician, because there are certain things that can be corrected, and it will diminish your chances or somebody's chances of developing Alzheimer's.
That's
Thank you so
I hope
much.
That's a good answer.
That's a good answer. You got a good panel.
I got a great panel.
Okay,
Who's that, a
love you
dog in the
guys.
background?
Well, yeah, I got a dog.
Oh.
Big dog.
So, Rosemary, call us back next
oh,
week.
I will. And
Okay.
pray for Pat.
Pray for Pat.
Okay, bye.
Take care. Well, we've been working hard, so we're entitled to a short break. Before we take that break, though, I'd like to remind you about the Net Viewers Survey. I want to urge you to take a few minutes to answer this survey, either when you're waiting to go on the air, or you can do it at home. Send it in to the net at 1712 10th Avenue, Brooklyn, New York, 11215. If you know how to get on the computer, you can find it on our website at netny.net. Very important to fill out. Tonight's topics are geriatric and internal medicine, cardiology and breast disease and surgery. And the all-important quiz is, what's the #1 reason people call in sick to work? Got to get a right answer here. Don't go far. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are geriatrics, internal medicine, cardiology, breast disease, surgery. We have Dr. Marguerite Kutsina, Dr. David Shifter, and Dr. Robert Seminara. Now let's get right back to the questions. I think we have Joyce waiting for us on line 3. Hi, Joyce. Welcome to the Net.
Hi.
How are you?
Good night. I'm fine.
Where are you calling us from, Joyce?
Queens.
Queen, which part?
Forest Hills, 108th Street.
108th Street. Can you lower the radio in the background, the TV, I mean? Just lower the TV because we got a little delay. Hi, Joyce. You back?
I'm here.
Very good. So, you calling from what neighborhood?
Forest Hills.
Which?
Forest Hills.
Forest Hills.
Oh, Forest
I think she
Hills.
said.
You got a lot of nice places out there, right?
Yes.
What's your favorite? You like to cook,
I
don't
hardly
you?
go out. I take care of my Alzheimer's mother.
Oh, very nice. Taking care of her mom.
Yeah.
Very good. And you do the cooking.
Yes.
What'd you cook tonight?
I'm diabetic, so I mainly eat just a salad.
Okay, salad's good.
I eat every during the day.
Very good. What can we do for you?
I have a terrible pain. It's deep in the body, below the breast, and I've actually felt the breast, and the pain isn't in the breast, but it's below the breast in the rib cage, and it's very severe, and it's deep. And I just, kind of wonder what could cause such a horrible pain. I couldn't even sleep last night.
Was it, which breast? Is it both breasts?
No, the left.
The left breast. So I'm gonna ask. Everybody probably wants to weigh in this. I'm gonna start with cardiology, and then we're gonna move. What about pain under the left breast?
Deep.
Deep.
Deep pain, and the quality of the pain is very important. And if you're getting the pain, if it's new, and you get it when you're upset, or if you have to exert yourself going upstairs, carrying packages, it may be that it's related to poor flow through the arteries of the heart, some sort of blockage. And that is a significant finding, especially if it's new. If it's not related to exertion, then it could be something else. It could be something simple as a muscle pull. It could be a bony problem such as arthritis in the chest wall or something in the other soft tissue structures around there. But do you get it when you exert yourself?
I didn't exert myself. That's a funny thing. I didn't do much.
You can't do much.
You don't walk much?
No, and I do social work, and I sit most of the day and talk to people. And I was just baffled. What could have caused it? I didn't lift anything heavy.
Let me ask Dr. Katsina, what about the back? She's diabetic in the left side. You think could be intestines? Probably intestines?
It's, I would say probably it's less likely based on a location of a pain. And is it a shooting pain?
Yes, it's very painful. It's almost like a big sore.
Right, and it's, did you notice that there is anything that makes your pain worse or anything that makes it better?
Yes, like if I stretch, because I try to lie on my stomach, and it's like I stretch, it's like my, like when something is pinning against, like you have a tight clothing, but it's not my clothing, that's just the sensation.
Right,
Like
does it go to your back?
Tight, yeah?
Does it go to your back or to your arm?
Just under the, not under the armpit, just under the breast, into the...
Deep inside,
yes,
okay.
below the soft tissue of the breast.
Is it related to meals in any way?
If it could be meals?
Yeah, it's related to the food. Does it happen when you eat or if you don't eat for a long time?
Well, I ate very well prior to the severe pain that came on. But I did eat very crazy yesterday. I sure did because.
But did your pain get worse after you ate?
I didn't feel any pain after eating. It's just when I was sleeping, I was awoken by the very severe pain when I turned over to lie on the stomach.
I see.
Dr. Seminara.
Yeah, there's a funny named disease for something that you may have, and I want you to go to your doctor. There's a thing called tsetse syndrome.
TT.
It's a funny name, tsetse. And if you tell your doctor, do you think I have tsetse syndrome, it will be very nice. That's where you get arthritis from the ribs, where the cartilage is, on your chest. And when you take a deep, deep breath or turn a certain way, or stretch a certain way, all of a sudden you get a pain that feels very deep. This may be what you have, but just like Dr. Shifter said, make sure you go and see your medical doctor because you may need a cardiogram too just to make sure you don't have the other problem. And with all the work you do, go take care of yourself and go see your doctor about that.
Thanks a lot, Joyce.
Thank you
Joyce,
very much.
You're welcome.
Very nice.
Bye-bye.
You have an answer for our quiz?
Yes, I think it's when you dislike your job. Somehow you always call in sick.
Interesting.
Avoid being there.
Yeah.
Is the number one reason to call in sick at work that you really don't like your job?
Yes, especially if you're not sick and you say you're sick. It's to get away from the work.
It was a great thought, a beautiful thought, but close but no cigar. Okay, I'm glad.
She's laughing now.
We're glad. I like that, but I like the thought process. I'm watching the way you guys think, when they come up with a problem. I think the audience, I've been told, they like to see that, how, whether it's a surgical, cardiology, or internal medicine approach. Let's go to Mariana. Mariana?
Yes, it's Marina, but it's okay.
Marina's a nice name.
Thank you.
What does it mean?
I don't know. I think it may have something to do with the ocean.
Oh, that's, yeah.
Oh, yeah, you're
Marina,
right.
very nice, with the ocean. Where are you calling us from?
East 61st Street in Manhattan.
Oh, one of the high-class neighborhoods, huh? Pretty nice. We're getting up there in the world. What do you think?
I don't know about a high-class neighborhood. I've lived in the area many, many years.
Oh, okay.
Long before gentrification.
Yeah, that's a nice area. You walk along Madison Avenue in the 60s there?
It's a wonderful area.
Really fun area to walk around. Anyway, what can we do for you?
Okay, my dilemma is complex. Let me just say this. I do have, in the cervical spine, I do have bulging discs from 1 through 7, including stenosis and spondylosis, I think they call it.
So you got problems with the cervical spine?
Yes.
Okay, arthritis and all kinds of disc problems.
Well, I don't know about arthritis. They didn't say that, but I was involved in an accident And so I have bulging disc stenosis and spondylosis, also on the lumbar spine. But this is the main issue. A few years ago, it started out with the pain in like my left side, like the lower lung area, like right underneath the rib cage. Okay, it was like a burning kind of sensation. And I had a colonoscopy and an endoscopy. Everything came up clean. Okay, as time went on, that burning sensation just increased, and it seemed like it began to radiate. Then I started developing a severe burning in my sinuses. But what's happened is over the last couple of years, serious sinusitis. So what has happened in the last couple of years, I now have this searing burning throughout my face, primarily on the left side.
So Marina, I need to get the question because I want to try and
The question is, what kind of tests should I have a doctor perform to find out, because I went to see a neurologist to find out if, to isolate this and find out exactly what's causing the problem. I went to the dentist. It's come up clean.
Okay.
I may have some TMJ, but I also have severe burning behind the left eye. All of this problem seems to be centered on the left side of the body, to the point now where my skin on my face is beginning to peel.
All right, Marina, let me see this. Let's see. Terrible pain in the sinus is burning.
It's mostly on the left side, and there is also a pain behind your left eye, right? I think you should see two doctors. One is the ophthalmologist, the eye doctor. He will have to look inside your eye, check the pressure inside your eye, because all the symptoms that you've been describing can be attributed to the elevated pressure inside your eye. So this is, you'll have to see the eye doctor.
Okay,
and
I did that and it came up clean. But
okay, that's good.
Okay, that's good. And then the neurologist, and I think it's it also depends, on examination. But I think the neurologist may order the MRI of the brain to look for any lesions, anything in the brain that can be causing you symptoms, because there are certain neurological conditions that can be giving the symptoms that you've been describing.
Any other thoughts, panel?
It also sounds possibly that she has a chronic infection in her sinuses, and maybe even an ENT evaluation or a specialized scan of the sinuses.
Marina, I hope you're going to call us back and let us know of your progress.
Well, I did have the ENT specialist, and it came up clean.
So I sound like what we need to do is get the
what kind
scan.
of medicine? Okay, is there a particular medicine that I can get to stop the searing burning?
I think we got to find out what's causing it to know what to get, rather than just covering it up. So it sounds like what Dr. Cassina said. The next step would be to get an MRI of the sinuses, or a CAT scan of the sinuses.
CAT scan of the sinuses,
and that done.
And MRI of the brain, because it's a neurological condition, can give you the symptoms that
I think when those are negative, then we can talk about painkillers and covering up the pain. But let's find out and make sure there's nothing serious that we can treat. Okay?
Negative.
Thanks a lot. We're going to go to Marty now. Hi, Marty.
Yeah.
Marty, where are you calling us from?
Midwood.
Midwood. Which area?
Ocean Parkway.
Ocean Parkway. We had nice restaurants out there, right?
Yeah, there's, of course, you got the Farah's.
The Farah's Pizza, one of the best in the city.
Yeah, and then there's a place on Coney and J, Essen.
Right, how is that?
Excellent.
That's delicatessen, right?
Right. It was Essex on Coney, but now it's called Essen.
A little bit on the fatty side.
No? Yeah, no, it's good.
It depends on the taste.
Yeah.
It's delicious.
Marty, what can we do for you tonight?
All righty. I'll try to make this quick. I've been dealing with workers' compensation for 7 years. It's a nightmare. I have multiple issues with herniations, leading to depression. It's just basically I have no faith in the healthcare system at this time. I go to my regular doctor, and he's seeing 80 patients a day. What kind of care am I getting?
Marty.
Yeah.
So I want to try and focus on the question, because I want to get to it, and I have so many callers. What's the question?
All righty. How would I go about getting a doctor that would be an advocate and somehow coordinate my work injuries.
So Marty's worried about getting rushed in and out. He wants to get a doctor who's going to take the time to talk to him and help coordinate the care.
But he also interested in having the doctor that would coordinate the worker compensation process, right? This is what you've been asking?
Yes, and that's causing, I've become afraid to deal with these doctors. It's a nightmare. Dealing with the workers' compensation. It's a whole mishmash.
We get the idea. Now I just want to see if there's an answer here.
Yeah, but the answer is, if you, this is what I believe in. If you're not satisfied with your current provider, with your doctor, regardless of the specialty, you can find, second opinion, third opinion. You can see as many doctors as you would like. You'll just, because it's, if you deal with the worker compensation, it has to be the doctor who takes, who takes worker compensation. And I'm sure there are a number of doctors who do take the worker compensation, and you can see, the panel is big enough, and just you have to try and see who you'll be feeling more comfortable with.
Any other suggestions for this frustrating problem?
I think I'd like to see you in the hands of a physiatrist. Are you familiar with physiatry? It's a doctor that handles and can put together for you a lot of the different problems about pain, motion, and also compensation, and probably give you a lot more attention than the way it's been for you.
Tough problem, Marty, but I think probably a lot of people in this boat.
I'm seeing a psychiatrist, but it's a workers' compensation
Physiatrist.
Physiatrist.
No, physiatrists are usually involved because I'm sure you do get different kind of physical therapy and
Marty, if you want to call after the show, we'll give you a name of physiatrist and can help you get on. And just to cheer you up, you want to go for the quiz? Maybe you can win. What's the #1 answer people calling sick to work?
Well, actually, the last answer was what I was leaning towards, that you don't like your work environment.
Right.
Not too happy.
But let's see. Stomach aches.
Oh, stomach ache. Good
That's
answer.
a good idea, yes.
Could the answer be the #1 reason people calling sick to work is stomach ache? Ah, Marty, but anyway, do it. You can call us up after the show, and I hope you feel better. I know you're going through a tough time. Take care. We now have Larry. Hi, Larry.
Hi, Dr. Garner. How are you?
Now, you weren't on the show last week. Why did you call in sick? I don't know what happened to Larry last week. I built him up, and it was another Larry. Yeah.
I think that they call in sick because they have to take care of a family member.
Wait.
That's the quiz answer.
The quiz answer, could it be? Why do people, the #1 answer they call in sick, it's due to a family problem?
Right.
Is that correct?
Yeah, well...
No, I'm going to let our drummer, we pay a lot of money for this. Wait.
No.
There's
no drum roll this time.
Total, can we go back to that drum roll? Is it family? It's a tough judge there. I thought that was a good answer. I don't know.
Well, we gave it a shot anyway.
All right, you probably discussed it now.
I have a question for Dr. Kotsinia or Seminary. Perhaps maybe they can help. We have a family member who's considering having a hip repair, but it's not the traditional hip repair where they put in a joint. They put in a cap and a cup, and it's supposed to be just as good as a traditional hip. Can they tell me anything about how safe it is?
Anybody know?
Sounds like a regular hip.
Some kind of a variation on hip replacement.
variation on a partial hip.
I don't know if we...
I would say this is a very specific question, and I think it's the best way, the best person to get advice from would be the orthopedist. Not even the rheumatologist. You need definitely the specialist who will be, who will have the expertise in answering the question.
Are you familiar with an alternative to the standard hip replacement?
I'm not sure. I'm not sure what to answer.
Dr. Shifter.
Who's having the hip?
I don't know. Who's having this?
My son.
Your son. How old is his son?
He's 56.
56. And does he have any medical conditions? Because being a cardiologist, my concern would be if he could even go through a surgery first. He needs to be screened, and if the surgery could be done safely. So he needs to have that done at probably concurrently as he's seeing the orthopedist.
Now, last week we had the orthopedist here. I'm sorry we didn't get to it, but
I can't comment on the specifics of that technique or apparatus that you spoke, Marty, but I can tell you this. When it comes to hip replacement, hip repair, hip adjustments today, the progress is phenomenal. And in almost all cases, the progress and the post-op period and the improvement after hip surgery, particularly for degenerative problems, is excellent today. Much, much better than it was even 10 to 15 years ago. So I would say the prognosis looks good, and do what our panelists advise. Talk to your doctor and
Larry,
go forward.
I want to, this is one of the first times I've ever had one to ask the doctor. I thought you might have had the right answer, so I'm going to ask the judges to flash me the right answer, but don't go far from the phone. We may call you back if it's the right answer.
Okay, Doc. I appreciate it.
All right, have a good night.
You too.
Take care. So that was quick. He said family issues.
Family
All right,
issues.
we're going to see what the judges say about that. We're going to go to Anthony now. Hi, Anthony.
Hey, Doc, how are you?
Anthony, how you doing? Where are you calling us from?
Middle Village.
Middle Village. And we spoke to you last week?
Yeah, we spoke last
I remember. How are things going?
week. Things are good. I was just calling about the trivia question.
Oh, yeah. I was surprised. I thought that last answer was pretty good, but let me build it up a little bit. What is the #1 reason people call in sick to work? And Anthony says?
Having diarrhea.
Oh.
Having diarrhea. Okay.
It's like a stomachache.
These are all good answers. All good answers. I mean, a little distasteful, but good answers. So, but Anthony, what can we do? Anything else? Any medical issues?
No, I'm doing okay. Just say happy birthday to Louie, that's all.
Oh, how old is Louie?
Louie's 17 today.
Oh, great. Where is he? Is he out in Middle Village?
He's in Flushing, Kew Garden Hills.
Is your relative or friend?
My younger brother, yeah.
Oh, Louie, we want to wish you the happiest birthday. 17 years old, just starting out in life. What is he in? Is he going to college next year?
He's going to college next year, yes.
Where's he going to go?
That I'm not too sure of yet.
Very good. See these costs for college. I don't know if you guys went through this.
Sure.
A little bit of money.
No, a lot of money.
But anyway, it's good. It's better to spend it on somebody who's sick.
That's it.
All right, I have a late breaking news bulletin.
Thanks,
The
Doc.
judges say give it to Larry. So what I'd like to hear, I hope Larry's relaxed. This can break your heart. This can,
Well,
I just want to hear that thing. Was the answer helping a family situation? Oh,
all right.
One of the few times we've ever seen our drum roll people not go through with the answer, but they made up for it. So, Anthony, you're part of history. Okay? Good. Well, let's take the email number from Stephanie. Her problem is she's been on Zoloft for 6 years. She had a generic band, and since then has a heart racing, dizziness, and some nausea. I see my doctor Saturday. I can't sleep. I love the show. Write if you can. So how can we help her? Is the generic?
It's some palpitations and nausea can be the side effect of Zoloft, and it's a well-known side effect. Now, there is a difference, I think, it's between the brand and generics, and the accepted difference in action, so to speak, is about 10%. So maybe this is what you're lacking in the brand name or in generic Zoloft that you've been taking. So that my advice to you is that please call your doctor. Do not even wait until your appointment on Saturday, because maybe there is something else is going on, and you don't wait. You need to speak to your doctor. Just do what the doctor says. Maybe stop the medication. Maybe there is some other problems, with the complaints that you've been describing. Unfortunately, you're not able to answer the questions that might help us to give you more precise advice.
Any other comments?
I think what the reason she's really on the Zoloft in the beginning for, if she's on the Zoloft for an anxiety or panic attack disorder, and she's switched the brand, maybe that the level of the drug is not good enough, and she's having a recurrence of her original symptoms. So it's important to go back to the doctor you first prescribed the medication and see if they need to adjust the dose or even change back to the brand.
Excellent. We're going to go to Grace now, but I wanted Patty, if you're still, Patty from Staten Island, we're going to answer your email next. So let's go to Grace. Hi, Grace. Grace?
No, this is Larry.
Oh, Larry, this is a different Larry now. I'm all confused.
Oh,
now.
right.
Where are you from?
I'm a new Larry.
New Larry.
We haven't had a new Larry in a while.
Hi, how you doing?
How you doing? You like the show?
Oh yeah, I like your show, and I'm honored to be a
new Larry.
Not a contestant, but a question asker.
Very good.
I live in Chelsea.
Oh, very nice. Now just give us a little bit of Manhattan restaurant scene. Give us a couple of choices out there.
There's very many. There's Chinese restaurants, Thai food, and there's Japanese one in my building, Japanese restaurant. There's health food. There's the dish. There's
vegetarian. Anything vegetarian out there?
Yes, yeah. Well, you can get vegetarian in Indian restaurant here.
Excellent. You got a really
something called Better Burger.
Better Burger. My daughter used to live around there next to that store, Garden of Eden.
Yes. That's 7th Avenue and 23rd.
Right. Anyway, they tell me I got to speed up, but I wanted to give you a due. There's a new Larry. What's the question?
Okay. Great. Oh, thanks. Okay. I think we're on schedule here. I'm watching the TV. Okay. So, my question is this: what do you do about severe arthritis in the neck?
How old are you?
I've had this. I'm 51 years old.
Okay.
It hurts every day of my life, and it's probably inherited because my mother has a neck problem.
Now, Larry, we're going to rush it a little bit because we get so many calls. Who's going to grab that one in a minute?
So I'll start, and then the panel will pick up. So the first thing is, again, as I always say, that you have to see the doctor, the neurologist, because it also depends on if there is any signs of the nerve impingement, because the approach is different. Let's say there is, your neurological examination is completely normal. So what the next step would be a lot of times physical therapy, stretching exercises. It is very important to see the physical therapist first, even if you are to do the exercises, because they will be able to give you the exercises that fit you the best, and they will show you the right way to do it. The next option would be, if it's not effective, different medications. If there is no effect from that, you go, the next step is a pain management doctor.
Well, I do take glucosamine and calcium every single day for the past 10 years.
Right.
I also get Botox shots in my neck to stabilize the neck because sometimes I do sometimes hear grinding behind my neck, which is terrible.
Larry, I need you to do something because we're running out of time. If you call next week at 5 today, we're going to take your call first and give it some more time.
Oh, all right. Next week?
Yeah, we got a date. Next Tuesday.
Okay,
thanks
a lot.
Let's go to Marsha. Marsha, hi.
Hi.
Marsha, how are you tonight?
Good night. This is not Marsha. This is Rose.
Rose. Okay, another nice name. Beautiful name, Rose. We like that. What can we do for you?
Okay, I have a question for you. My husband has brain tumor.
Brain tumor, okay.
And the doctors, they refuse to do the surgery. And there is no treatment. They're saying that they don't have like any specific medication for it.
How old is he?
He's 47.
Wow, sad case. So let's ask Dr. Seminar, why can't they operate?
Well, there are some tumors that are prohibitive, or their location in the brain would just make it very, very difficult. However, there may be some other avenues you want to discuss with your surgeon and your family doctor, whether other things like radiation or other things might be helpful at this time. And sometimes with radiotherapy and some of the newer things that are out there, patients can do a lot better than anticipated.
Rose, so it's important to follow up with what your doctor's saying, because there's a reason why he's telling you it's not surgical, repaired. We hope that he does well, okay? Be well.
Yes.
Let's go to our email number 3 from Patty. Last email of the night. My friend has a swollen belly the size of a 9-month pregnancy. She's in a lot of pain. It's gone on for 6 months. She went through colonoscopies. She went through upper GIs, CAT scans, MRIs, sonograms, all coming back normal. Next step, her doctor wants her to go to an endocrinologist. No one has the answer. Any suggestions? Tough one.
It's a tough one. First of all, it's not, we don't know what the age of the patient is.
Yeah, it's a tough thing. At least we've ruled out a lot of the serious tumors and so on. She has a 9-month size thing. It should have shown up on an MRI or CAT scan. So that's good news. Keep us posted. Let her go to the endocrinologist. Give us the answers. But I'm getting rushed along here, so I'm going to have to say goodbye and good night. I want to thank our guests, Dr. Marguerite Katsina, Dr. David Shifter, Dr. Robert Seminara, for coming in. And we hope we've been able to help you. It's good to remember that you should always be proactive about your health. Speak to your doctors about your concerns. And just as we talked tonight, you got to go for second, even third opinions. Don't take anything for granted. Next week, we're going to discuss foot surgery, cardiology, and internal medicine. Now, you want to visit our website. It's really good at netny.net/askthedoctor. Here you can read the Tablet Weekly column, podcast, the forum, email your questions in, and take that viewer survey. Remember, you want to fill that out, give your honest opinion about Ask the Doctor. If you don't have anything good to say, then it doesn't have to be honest. Just say good. I want to thank you, those who also participated. Thank you to Dr. Linda Lapatosa, our quizmaster. I want to thank you all for your questions. Also, now tune in tonight for 10 o'clock encore presentation of last week's show. In case you missed it or you want to watch it again, it'll be at 10 o'clock, and you'll watch it. I want to say goodbye, have a great week, and I'll see you in the tablet.